We're going to demonstrate how you can use ChatGPT to act as a simulated patient. So you can see the prompt that I've given ChatGPT is to act as a patient called Beryl, who's been admitted to the hospital emergency department with an exacerbation of her chronic condition, a little bit of medical background and some information about how she's managing. I've asked ChatGPT to interact with me as a student, as though they are this patient and I'm the student nurse. And I've given a prompt as well to say that the student has been instructed to use the Roper, Logan and Tierney model to ask the various questions. I've also prompted that I want ChatGPT to answer in an authentic way and to add in any particular gaps. So the first question I've asked as a student is, how are you doing today? So you can see that ChatGPT says, oh, hello dear, I've seen better days, and so on. So the student might say something like, can you tell me more about why it's been a tough day? And we can see that ChatGPT's response centres around her breathing as Beryl, quite an authentic response. The language, I've given a prompt to not use any particular medical terms, but to respond in an authentic way. So perhaps the student might ask what medicines Beryl is taking. Now, I've given it a prompt to confirm that she takes metformin, but then you can see it's also intuited that there's an inhaler there. So perhaps I'll ask, what inhaler are you on and how often do you take it? So we can see the response here, and it's giving a bit of a clinical picture of a developing exacerbation. Gives it a bit of relief, but doesn't seem to be doing the trick like it used to. So what led you to be admitted to the hospital today, Carol? And often we give a printed clinical case study and we get students to work in an interactive way to imagine that the patient is there. And there's something about using ChatGPT that brings it very much alive, because there are responses that we may not have thought to put on a written scenario. So let's just see what she's worried about. Are you worried about anything in particular? So she's concerned about her breathing. You can see that there's some anxiety, and then something about the setup at home. Tell me about your husband and his health condition. So this is something I haven't prompted GPT to respond, so I'm asking it to create it, and it's invented some arthritis, some pain, a little bit about the fact that he doesn't like to ask for help. It's just the two of us. Do you have any other support? Let's see what it invents for this. Just thinking about it. I always get reassured when it's thinking about it, because I can usually anticipate it will provide a little bit more detail. So they've got a daughter with a job, and young kids. They've got neighbours, but mostly they're on their own. Okay, so now I can ask ChatGPT to no longer be Beryl, and now to act as a clinical educator who has observed the interaction, and to give the student feedback on the quality of the questions that they asked. So you can see it's kind of framed it within what we know to be the required communication skills. It's also given some tips for improvement. So you'll have noticed that nothing specific was asked about Beryl's emotional and psychological state, so it's picked up on that. Explaining a little bit about the hospital admission, and generally giving some quite helpful feedback. It's just a very quick tour of the kind of ways in which ChatGPT can act as a simulated patient.